guys, to the spinal care class. I promise if you guys listen to this information with an open heart, the information I'm going to give you can help your health and the health of your family in a big way. So before I show you the exercises, I want to show you or tell you at least why we do the exercises. Because what I found after 32 years in practice is that when a patient doesn't understand the difference between the pain and the problem, when the pain goes away, what do you think happens to the patient and their care? They stop, right? It's human nature. We always believe that if we have pain, there's a problem, and if there's no pain, really there's no problems. But that's not true, right? Because you all could name something that could be in your body. They call them silent villains or silent killers that could be there for years before they ever have pain. Things like cancer or heart disease, things like that. They're silent in the body until they've been there for a long enough time to start to cause pain. Even in the spine, like scoliosis, which is a curvature of the spine, I've seen patients come in that needed surgery or surgery is recommended, and they had a curve, like a really huge curve, like a 55-degree curve, and I'll say to the patient, what hurts you? And they'll say, nothing. And you're like, well, how could you have such a curve and the doctor wants to do surgery even though you don't hurt? Because if they leave that there, they're gonna have pain in the future or maybe some internal organ problems down the road, okay? So it's not good to have a problem even though you don't have pain. Does that make sense? So if the pain goes away and the problem's still there, you're not really done with correction, even though the pain went away. Pain usually goes away within the first maybe 2 weeks or a month or so, but the problem takes a little bit longer to fix. Does that make sense? And what the problem is, typically in chiropractic, what do chiropractors treat, is chiropractors treat the spine. And the reason why we're treating the spine is because the spine was created to surround and protect the spinal cord and nerves, and the nervous system is the most important system in the body. The nervous system controls the running and the healing of the body. Like right now, you're hearing me, you're interpreting what I'm saying, you're digesting food, our hearts are beating, our lungs are breathing. Millions of things are happening without us really even knowing it, kind of innately or automatically in our body. And that is controlled by the brain and nervous system. Even healing is controlled by the brain and nervous system. If you cut yourself or you break your leg or you have a cold, the body innately knows how to heal itself and send the right signals to where they need to go and get the body to function and heal properly, okay? So the spine, when you look at it, from the front, the spine should be totally straight or as straight as can be. But from the side, the spine actually has curves to it. And that's what our exercise and traction is going to be doing in the office and at home, trying to restore the spine to its near to normal alignment as possible. Does that make sense? Because the better the structure, the better the function of the body. And people always ask me, how does the structure affect the function? Well, we said that the nerves come out of the spine and they go to all the muscles and glands and tissues and organs of the body, right? So nerves come out and they go to your heart, your lungs, your stomach, they go down to your arm, down your leg, wherever a vertebrae is, where a nerve comes out between two vertebrae, they travel to different parts of the body. Does that make sense? So how does the structure affect the function? Well, I'll do a little quick experiment with you, okay? So everybody sit up straight in their chair, okay? And I want you to tuck your chin down like your head's forward, okay? And while your head's down, I want you to take a deep breath in while your head's flexed down. And then let it out. And then I want you to sit up straight where your ears more over your shoulder and you're looking straight ahead, and take the same deep breath in. And let it out. You feel the difference? Raise your hand if you can feel a difference out there, right? So that's how your posture can affect your lung capacity. How about this? Everybody tuck their chin down again. This is the last time you'll hear a chiropractor say slouch down. While your chin's tucked all the way down, try to rotate your head to the left and then rotate your head to the right. Okay, and then stand up straight in that nice normal posture, ear over your shoulder, and turn your head over your left shoulder and turn your head over your right shoulder. And tell me if you felt like you could move better with a normal posture versus a flex posture. Does that make sense? Now, if you look at people in today's society, you see a lot of people what we call forward head posture, right? And why is that? Cell phones, probably the #1 thing, right? Students are on laptops, computers, cell phones, reading, you know, even seniors a lot of times, they're still They're all on the phone, 2-3 hours, maybe 4 hours a day or more. And that's creating a forward head posture. So chiropractic's really the only profession that actually looks at that and says, hey, that's putting irritation or abnormal stress and strain on the muscles, the ligaments, the joints, the disc, but most importantly upon the spinal cord and nerves, and that's not a good thing. So let's go ahead and try to attempt to fix that to as near to normal as possible before the body starts to degenerate and break down and get pain and things like that in the future. You see what I'm saying? So it's a very preventative thing. What is another common cause of the head going forward or someone losing the normal curve in their neck? It's very, very traumatic and very, very stressful on the body. Whiplash, very good. It's car accidents. When you're rear-ended, you lose that curve in your neck a lot of the time, and you get that forward head posture and stress and strain on the joints and the muscles and ligaments and disc and things like that, right? So that kind of a person, even if you had an accident 15 years ago, that needs to get corrected if we can, or get it to as near to normal as possible. Does that make sense? Mm-hmm. Okay, so here's how we do that. We do that with 3 things. Chiropractic care, right? In the office. Exercises in the office and at home, and traction in the office and at home. Like you guys were both on traction today, so you know what that feels like, and we had you do exercises, so you know what that feels like in the office. But now we're going to show you the home portion. So about 50% of the treatment comes from you bringing your body here and me working on you, and you're doing your stuff in the office. The other 50% is going to come from the home care, right? So home care is just as important as in-office care. It's kind of like a 50-50 partnership. You do your part at home and I do my part in the office, and at the end of about 3 months' time, most people are about as near to normal postures they can get. If you don't do the exercise at home, and you only come here, when you get about 3 months into it and we take a progress exam or x-rays, you're only going to be about 50% corrected because you didn't do your part of the 50-50 contract and relationship. Does that make sense? Okay, so it's very important to get in the office consistently and do your home care consistently. Does that make sense? Okay, so the exercises are quite simple. The first exercise is called Superman. And all of you here are going to start with the middle picture, or the intermediate exercise. So she's lying on her, can you see that okay? She's lying on her back, and she's taking her opposite arm and her opposite leg up, and then she lets that down, and then she's going to do the other side, opposite leg, opposite arm, and she's going to do that maybe 4 or 5 times, 4 or 5 sets of 10, 40 or 50 repetitions, okay? Does that make sense? That's called dead bug. So I'm going to come on your next visit, I'm going to say, show me your dead bug, and the next exercise is called Superman, and I'll say, show me the Superman exercise. So in Superman, it's pretty much the same. We're going to do the intermediate one, the middle picture. We're going to lie on our bellies, and we're going to take the opposite arm, opposite leg, and the head up to get all the muscles working to bring the spine into the right posture. And again, you're going to do that 4 to 5 sets of 10, 40 to 50 repetitions. And then as soon as you do that, you got about 5 minutes or so, everything's warmed up, to lie on the home traction. Okay, so the exercise build the muscles up that pull the body in the right posture, and they also warm up the tissues to prepare you for the home traction. Okay, sometimes we call them home fulcrums as well. So the fulcrums, they're here. One's for the neck and one's for the lower back. Okay, and then these are nice because they're perforated, and you can take off the bottom pieces. The whole group just maybe start out with the top one. Maybe you can, since you're tall, can start with the top 2 together for the neck and the lower back. And then as you get better at it, once you get up to 20 minutes of it or so, then you can start adding the additional bases to make it taller, because once you get to 20 minutes, your body kind of gets accustomed to it, and you need to increase the space to make you still get the benefits of the traction. Okay, so if you look at this picture, she put one under her neck, right at the collar, right above her collar, and one in her lower back right above her belt. So say that with me, belt and collar. That's how you know where they go, just above the belt, just above the collar. And what is she doing here with her knees? She's bending her knees up because that relaxes the muscles and lets her get a better stretch. So So you're gonna lie on this, probably just on the top one for you if you're not as tall, and you're very tall, so we'll start with the top two. Okay, these are all perforated where they come apart, they peel off, and you lie on it just for a minute the first time, maybe 3 minutes at the most. Set a timer,
like, oh
right? So set a timer, 1 to 3 minutes. Do it at home for 1 to 3 minutes. If you're sore, you get pain down your arms, you automatically stop. But you have to set that timer because sometimes people fall asleep on it, or they don't know it's 3 minutes before you know it, it's 20 minutes and you wake up sore, okay? So not for sleeping, but for recorrecting your posture, okay? So you're gonna do a minute the first day, the next day 2 minutes, or you could do 3 minutes the first day if it's not bad, and the next day you add a minute. The day after that you add another minute. So you can do this for 15 to 20 minutes, and then you add another level, and you start all over again, okay? So the goal is to get to 20 minutes, 6 days a week, and be adjusted every other day, 3 times a week, or as best you can, to get you to be as best posture as possible, so that your nerve flow is best and your movement is best, your organs are doing as best they can, so that your body's actually healthier, so you can live your best life and do the things you like to do as long as you can in life. Does that make sense? Okay, so I'm going to give these to you. You're going to take them home. You're going to try them again. If it hurts you, you stop. If you missed anything, you can go to our website, which is drcasabona.com, and you can look on our videos, and we have videos of our staff doing the exercise and traction. Does that make sense? Okay, so I want to thank you guys for coming out. Do your stuff at home, and on your next visit when you come in, I'll quiz you. And you'll show me what it looks like. And the quiz is really not to see if you're doing well, because everybody forgets. The quiz is really for me to just check and see how well I'm teaching. Okay, thanks for coming out, and I'll see you on your next visit.